constipation. So we've talked about, how common it is, what is the workup. Now let's talk about the treatment of constipation. Now it starts with very basic steps, making sure that there is no underlying medical condition, or we take care of that condition, see what medications is she taking, can we adjust those medications so that they're not interfering with her bowel function. For example, if I put a patient on an overactive bladder medication and she's taking an anticholinergic medication and she's getting badly constipated, I can replace that with a different medication called a beta agonist medication, which does not have the same risk factor of constipation. So those little changes we could make, knowing the entire medical history of the patient. Once we realize that it's not any medications or medical history that's causing it, then of course the first step is diet and exercise. That's key. What about diet? Increasing the fiber in the diet, making sure that the patient is drinking adequate fluids. Now, sometimes if they have a concomitant bladder problem and urgency and frequency, they may not be drinking adequately in fluids. So they need to drink appropriately. Good amount of fluids is important. Number 2, which is about 60 to 65 ounces in a day of water. Second is increasing the fiber. Now, the diet also, there's certain food items can slow it down, like carbohydrates, but then you can increase the roughage and the fiber. But that has to be increased gradually. Sudden increase in the fiber can cause an issue with flatulence and gas buildup. So you slowly increase the fiber, every few days, increasing up to maybe 10 to 15 grams of fiber. And you can take, whatever, whether it's FiberCon, any local brand would be fine. So gradually increasing this up. So that increases the bulk of the stools. And when there's increased bulk, it's easier to expel the stools out.